Hi, welcome back to Mike's Diabetes World. Yes, 'tis I am back to prepare my wise and wisdom. Yeah, wise and wisdom. Today I just want to talk about my experiences. You know, for the years that I didn't have an endocrinologist was absolutely the worst looking back on my diabetic care. And did I ever make mistakes? And I'm surprised I still am around. Because mistakes I made, and they were truly mistakes, I wasn't trying to cover anything. But what I really want to discuss is your diabetes and surgery. The first time that I really had surgery was I had a problem in the down part, backside, we'll say. And it had to be corrected. So I worked the night before, which I told the story. And I actually surprised myself. I didn't eat all night. I kept working. I took my normal insulin at 6 or whatever, 6 or 9 or whatever it was. And then I worked the whole shift, came home, and was sort of taken to the hospital. Now I'm half out of it anyway. I just want to sleep anyway. They probably could have done the operation that day, and I probably wouldn't have known the difference. Anyway, I went into the hospital. I got checked in, and they did a blood sugar on me, and I was crashing. I don't know, whatever. I think I was like 20 something. And the doctor said, well, did you take your insulin today? And I said, yes. And he said, why did you take your insulin? And I said, because everything I've read said to take your insulin before the surgeries. What a mistake. The second time I had it, I went in there and they looked at my insulin pump, which is over here. And just for us, since I was low early in an earlier video, I'll just show you right now. I am at, if you can see that, 6.1. So I am normal. Sorry, people. Besides all your little whims and what, I am normal. Ha ha. Now, in this case, I didn't take any insulin before going in, and my blood sugar went the other way, sky high. So my experience, and I'm not a doctor, check this out with your surgeon, your endocrinologist, even your family doctor. Before you go into surgery, you do need to take some insulin. Probably not your full dose, so don't be freaking out. Oh my God. But when I was on the pump, getting my kidney removal, things went a lot better. And there was another time, yes, I've had a few. I went for most of my life without having, but I made up for it. I went into surgery with my insulin pump. My endocrinologist scrubbed in, took my sensor off, and left me with my pump so that I was still getting insulin, but the sensor wasn't there trying to read blood sugar in case they had to put me on IV insulin, whatever. But I came out of that feeling okay. And that one, just for your information, if you're keeping any scores, that came out as an appendicitis. And there's only once have I felt sick coming out of anesthesia. And that is when I didn't take any insulin beforehand. And oh, my blood sugar went high. And my blood sugar went high when I got wisdom teeth taken out. After, they kept me in the hospital a little bit longer. And yes, I went to the hospital. I went to the hospital because I was diabetic. Yes, and I heard those magical little words, well, you're a diabetic, so we'll have to put you in the hospital. But instead of being in one night, I think I was in 3 nights for my wisdom teeth, which was great because if I felt kind of sore, they could just put something in my IV and I would pass out. And oh, that was nice. I didn't have to fight you being at home. Chipmunk cheeks. Yes, I normally have chipmunk cheeks. I heard I got the joke out before you guys did. Ha 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 ha. But follow your doctor's leads. And you may want to modify your plans a bit. So even for something like mouth surgery, oral surgery, mouth surgery, schedule it later in the week so you could take a Friday off if you had to, Saturday, Sunday, and then the Monday. When I had my cataract surgeries, now this, I wasn't under general and could eat beforehand and everything. But everything was before a long weekend. So it was great because this eye was really starting to come into focus and I still had my strong eye. It could have been different if I had had bad cataracts. And then, I would have taken the extra time to heal. We're all so in a hurry to get back to our normal lives. And I said this before, you are the most important thing, and controlling your diabetes. Maybe plan, if you can, an extra day off, just so that you can be fully functional when you go to work. I told you in the sick video that you want to make sure that you are 100% and you can give your company the 100%. Don't sort of sit there and, I don't feel right. I think I'm going to go home early. That's not doing your company any good. You have to get things ready to go and be fully functional. And if you're not feeling well after surgery, take the time to get better. I don't know why I have to say this. Now, when I had my left kidney out, I just sat there and I really had to think about, will I be able to go back to work in a couple of days? And when you come out of surgery, you could be groggy, you could be fully wide awake, and I was fully wide awake. I called my secretary from when they finally got me back to my room. And I can remember, just a little side note here, is for the type of surgery I had, just have to itch, I couldn't drink anything after surgery, and I was low. I had a low blood sugar, and the nurse that was on gave me some cold apple juice. Like, it was almost freezing, and I was lying there and my throat hurt from the tube during surgery, and I took a drink, and oh, that felt so much better. And it was just something to kind of shock me back at, hey, there's nothing here to cause problems. But don't push yourself after surgery. Take the time to recuperate. It's important for everyone's body. We all kind of rush, oh, I've got to get back to work, I've got to do this, I've got to do that. Manage your blood sugars, and if at all possible, have you control your blood, your sugars. Once you kind of come out of the operation, you're lying there, you're awake, treat your blood highs and lows as you would at home. Because chances are, when they see you can do that, you'll be let go sooner. When I was in there, they finally gave me control, and my blood sugars were actually pretty much okay. So, take care of yourself. Know what to do before the surgery. Know when to call your doctor after surgery. And try to control your blood sugars in the hospital. Have a great day. We'll talk again soon. Bye now.